So Cynthia, you're here today 2 weeks after your left heel surgery, right?
Right.
And it's kind of an interesting case, and that's why I asked you to do this interview, because you're only 2 weeks after suffering with heel pain for how long?
About 3 years.
About 3 years. And it was something that didn't go away with cortisone shots, like anti-inflammatories. None of the non-surgical treatments worked, right?
Correct.
So you came to me basically pretty specifically inquiring about this new procedure called Tenex procedure, and I told you absolutely, because I think that it's definitely a very successful new procedure that you had 2 weeks ago. Well, tell me how you feel.
I feel great. I came to you because I was concerned that another doctor had said I'd have to have the release surgery. And I do not want to have release surgery because I know there's a lot of problems that go with that.
Yes.
So you said, well, I have this new procedure. If you're interested, you let me do the research for it, which was wonderful. And that was it. I was sold.
Right, and I told you that when it first came out about a year ago, I was cautiously optimistic, and I didn't really want to experiment on my patients, so I waited for about 6 months. And then I went to the American College of Foot and Ankle Surgeons meeting in Austin, Texas, and I was very impressed because they presented very strong data, right? And we always value the research when it's not just the company that is backing it up, but also when there are surgeons who do it and they don't get any kickbacks from the company. They just do it and they, publish their studies. And I was very impressed because they were both orthopedic surgeons and podiatrists working together. Actually, that panel that they had was 3 and 3 orthopedic surgeons and 3 podiatrists, and they basically collected the data from thousands of cases that they've performed, and it was definitely significant improvement. 96% is what they give us. So, I mean, considering, and I think the reason why I wanted you to do this interview is because you gave us this very important few words. You did not want to have the release surgery. Because the old-fashioned surgery was the surgery where we basically went in and cut the plantar fascia, which had all kinds of problems, right? And we know that obviously God created it there for a reason, so when we go and we alter it, there are other parts of the body that suffer, right? And I can tell you is that when there are new procedures that are coming out that are promising to preserve the anatomical alignment of the foot, we definitely look at it very closely because, listen, you walked the same day, right?
I walked out of there.
Yeah, you walked out of there, and were you like in a lot of pain?
No.
Right.
The pain I had, the pain I had was similar to the pain I'd had for 3 years.
Right.
It wasn't more.
Right.
But it's gotten considerably less each day.
Right, and it's only the beginning because you're 2 weeks tomorrow, and we're getting you out of the boot and you're doing physical therapy. And listen, I just looked at your ultrasound. If I didn't know you, I would know you had plantar fasciitis because according to the ultrasound, you are cured. Okay, so I think you're a very good example of how well you're also a very compliant, very good patient, because I believe that it takes 2 of us. And if we have teamwork, we have good results. And when we have patients who, take their dressings off the next day and they started going in the pool and don't wear their orthotics, that's obviously a very different situation. So good job. And thank you so much.